This is about you and your amazing journey through COVID, the teamwork and the innovation and inspirational practice to deliver the best care we can in health visiting in Allerdale and Copeland. You're all amazing and wanted to share this with everybody.
I'm Sarah Bell, one of the health visitors in the team, and I'm clinical lead as well. And I've been clinical leading here for not very long, really. I think I'd only been in the role for just over 12 months when we went into the pandemic.
When COVID happened, it was really stressful to find out what your job role was, how we were going to adapt to the virus and the pandemic. Really difficult. Lots of things needed sorted out. The images on the television were really stressful. I think we felt like we were really kind of fighting a war.
So I think quite a lot of us knew what was going to happen and could predict, which I don't know was a good thing really when we were watching what was happening in other countries. And from our point of view with Copeland, we all found we were working at home really, really quickly. So we thought really, how are we going to keep everybody connected? So we decided we would start with sort of a WhatsApp group between us all as a team so that we could all check in the morning, so that we knew where everybody was and where they were working from. Those that were on visits, we could use that for lone working so that we could tell our team members where we were and then when we were coming back, so that we had that safety point of view for that. Any little questions and things we could just ask if anybody was around for a phone call. Really even just simply, is anybody around for a cup of tea later, a coffee break? And we used it as sort of like almost like a panic room, like a timeout room for us to sort of debrief and just talk about what we were worrying about at the time. Chris had already had got us signed up with Skype for Business. So we started using Skype for our team meetings. And we decided really quickly that we would have some regular team meetings. So we had a weekly allocations meeting where the new babies and anyone that came into the service, any issues that had arisen with child protection could be allocated out to the team fairly. So that meant that family staff that were working at home could do telephone and follow-ups that way. We could go out and do the face-to-face.
The allocation system I thought was great. It meant that although the work was being shared out, it meant those people that weren't at work, you didn't feel the full effects of the absences so much because the work was being shared out equally. It was done systematically. That worked really, really well.
And then we also had weekly team meetings where it was well-being and checking in and seeing how we were doing, and it gave us a chance to disseminate information from the trust, because things were changing all the time with regards to PPE and how we were delivering our services. So it gave us a good opportunity to all meet together and join up face to face firstly over Skype, and then we were able to use Microsoft Teams. At the beginning of the pandemic, we were delivering quite, we were really prioritising what we were doing and seeing the new babies. And the early help team had asked us to send them spreadsheets of who we had on early help plans so that they could be, monitored and not lost in what was going on. We decided we would do lists of our families with some brief information on, and have that in a secure place on SharePoint in our trust, so that we could monitor how each practitioner was managing, how heavy the caseload was, but just not by the numbers that were on the caseload or how many primaries were coming in, but how heavy the work was with families that were taking up additional support. It also helped us to liaise with our GPs, because each one of us is a assigned contact for a GP surgery, but they may not be the families that are on our caseload. So that made it a lot easier for us to find out who we needed to bring to the GP practice meetings to talk to them about who we were worried about, as well as who the GPs were worried about. It meant we could cross-reference that, and those discussions with the GPs were a lot more useful. We made sure that we were accessible to families because we didn't have any clinic provision. So we agreed very early on that we would have duty numbers, and that we would have somebody on call who would be on duty. And initially it was those that were shielding that managed what we call the duty phones. And they were our usual office phones, so families who would be seen before the pandemic still had those numbers in their red books and on the literature that we'd given them previously. And they could ring in and ask for some advice. And whoever was on that day could either speak to them over the phone, arrange a face-to-face with somebody that could pop out and do a visit, or they could do a video consultation and speak to that family over the video. We're continuing with that duty phone, and certainly we'll continue to do that even if we do get to roll out clinics, because I find that's been quite really important for families, and we've found it really, really useful to maintain some contact with them. We spoke to Bev Corrigan, one of our other clinical leads in Penrith, because when there'd been some heavy snowfall in Alston in East Cumbria a few years ago, they'd really struggled to get out and see some of the clients, both the district nurses and the health visiting team. So they liaised with Cumbria Health on Call at the time, and we used their Attend Anywhere platform, because it was a secure platform that was with the NHS, and we could deliver a video contact with families, and it's really simple for families to use. So we started delivering some of our contacts that we couldn't get to face to face by Attend Anywhere, and that brought challenges of its own, having to deliver over telephone and over video. You're sharing and getting information back from your family. That reciprocation is very, very different. You haven't got a lot of other key clues and the things that you would normally see if you're face to face. So that took a little bit of adjusting to.
We were doing assessments over the phone, and that brought its benefits, because you could get through the work over the phone, and then if a visit was needed, you'd actually done the bulk of the assessment before you went on the visit, so the visit would just add to that. There were times when that was a great benefit, particularly if the parents were happy with the child's development.
We got the go-ahead from our comms team to be able to use social media to interact with our families, as in giving out information, supportive messages, public health messages, safe sleep messages, safety messages, things that we would normally have displayed in our clinic rooms. We've been able to show over social media, and we've been directing our mums to use our Facebook pages, particularly to pick up any information that we can deliver. Mid-pandemic, we got together as a team and discussed how we could support our families with their emerging needs. Families had been told not to get in touch with us because to reduce the use on the NHS. So we agreed that we would send out a letter and invite families to actually make an appointment with us, and we sent out the developmental questionnaires for that. And that pilot's still running now. We're looking at how successful that is. But the numbers of people returning and asking for an invitation has increased considerably. So we're able to highlight any developmental issues that parents have maybe not been aware of by seeing them at 1 and 2 years. We're able to do what we do as health visitors, stimulating an awareness of health needs and supporting families in meeting those health needs. So that's been a really successful thing that we've done, and I think that will probably continue as we come out of the pandemic. We've really had to try and look at how we're delivering our services, and I think the teamwork that we've established, we've been able to work completely across as a team and feel much more supportive of each other. And I think those weekly meetings that we had, as much as we'd roll our eyes and think, oh, we haven't got time for this, I think they were really, really important in gluing the team together. It's been an absolutely it's the most unusual time and very, very stressful. We've had families that would have normally ticked along quite nicely, but this pandemic came along and we found that they've become newly vulnerable. And I think that us going in as health visitors as a universal team and trying to contact every family, being able to uncover issues that families have maybe not been able to talk about or have not wanted to talk about or haven't known who to see or who to speak to. So I think we've managed to continue with our service with the challenges, and hopefully continue to support each other with our well-being and our own mental health as we progress and come out of the pandemic and watch what happens on the other side.
The spirit of teamwork. I found my colleagues so supportive and feel so much closer to them, and I really felt like people had each other's backs during the pandemic. I think, there's been a lot of, although it's been stressful, there's been a lot of good morale built during this pandemic.
Just want to thank everybody for contributing in their own way.
Thank you. You always rise to the challenge and shared our amazing journey. The development and learning has been inspirational for everybody. Congratulations, and so proud of you all.
Social distancing is the way we can stay healthy.